Okay. Did you guys enjoy that? I know you did because I seen all of the comments that were in the chat about how amazing it is to have these key partners with us here today, and we are so honored to have all of you here to share your expertise, to share your heart. We've truly felt your heart, and you know, none of this was done by chance. When we looked at who did we need to be here, who believes and has truly supported us through this fight, your names didn't just come randomly. So we really do appreciate your advocacy on every level for the work that CHWs are doing, but most importantly for your partnership. So thank you so much to the panelists for being here. We have set a time, some time for you all to take a break, to have some lunch. I'm just going to do a short presentation that people don't know that I was going to do this. So we're going to just do this really quick so that you can get something to eat and get stretched out, and then come back and join us for the amazing community panel that we have coming up next. But just to start, I wanted to do this without telling these people. So I hope you didn't log off yet, but because a lot of the people that you will see here today on this participating in this conference are people who have been really behind the scenes. I mean, yes, we see their name and we have to contact them, but they really have been the people in the background who have been just working hard to do, to advocate for us, to support us, and to just do the work that we need them to do in their positions. And so I wanted to just share some appreciation for these leaders that have been helping us. And when I say the beginning, I'm talking about, I moved here about 5 years ago and started my career here in Utah with the CHW movement in 2016 with the Utah Public Health Association. So it's not by chance again that I'm back with the Utah Public Health Association during this time. And so I wanted to just share, can we get it up? With you, some of the people that were there in the beginning with me as we started to work on this movement and move this initiative forward in the state. And so, okay, as soon as we get it up, I will share with you who these important people are or have been, and the efforts that they have put in has been, I mean, if they're not happy, I'll be happy for them, because we have really progressed since the beginning of this initiative. We've really moved and made a lot of progress in all of the work that we have been doing. And it started off, I think Jeanette shared in the beginning, and Kevin shared a little bit about this, with Jeanette having an idea of wanting to better support CHWs in Utah and promotoras, and talking and having a conversation with someone at the Department of Health. The coalition grew from there, and then a collaboration grew from there with the Utah Public Health Association and the Association of Utah Community Health. And now we're here where we are. So next slide. So this is just to recognize some of these people who you have already seen, most of them. Paul Whiteman, who is the executive director of the Utah Public Health Association. He has been an awesome boss, so supportive, and everything that we have done and tried to push for the CHWs, he just stands in the background and says, whatever you want to do, Areta, we're going to do it. And so he makes it happen. So I'm so grateful for him and his support. And then also Teresa, if you don't know, so Teresa has served in so many different capacities along this movement. She was at Intermountain Healthcare, where the grant started, and then moved to the different organizations. And every position that she had, she pushed this work. I mean, had an actual hand in pushing this work forward when it came to sustainable funding, when it came to, just organizing the section and everything, even to being able to present at the American Public Health Association. She has used her position to really support the work that we do. So I want to say thank you to the both of them, and also to the Utah Public Health Association board, and recognize the president, Patty Cross. Next slide. These two amazing champions, you all shared your thoughts about them in the chat. I just want to say thank you. it's such a privilege for me to work with the both of you. I don't know how else we would have done this without you two specifically in your positions. Thank you for being patient. Thank you for being allowed to be checked. I seen you say that in the chat, Tessa, because trust me, Tessa's been checked a lot. And I have to call her and say, thank you so much for your patience and just for understanding that we are serving and we share our emotion and our passion for this work. And so sometimes in our advocacy, we may come out very strong, but it's because, you know, it's just been frustrating. And then these two amazing people, you heard from Nubia and you felt her heart as she shared. So I just want to again echo my appreciation, Nubia, for all the work and advocacy that you have done on your level, especially with the multicultural subcommittee, and all the work that you are doing there with everyone who is involved in that subcommittee. We have attended different subcommittee meetings, with food security, with housing, with all the different committees, and everyone there is so amazing. They're always like wanting to know, how do we improve this? How do we best serve this community? What do we need to change? And so I love the discussions that are always happening at those meetings, and thank you so much. I put Claudia here. They may be wondering, she's one of the ones I see on every single email. She is always connecting, and when we wanted to get something said from the governor or shared from the governor, she was also on that email. And so I just wanted to give a shout out to her for all the work that she's doing in coordinating all of these efforts, especially for our governor and our multicultural affairs. Next slide. This is how behind the scenes these people are, but I'm glad that Dulce was a part of the panel. Dulce, I'm so grateful for your talent and your strength and your everything that you do at the Office of Health Disparities and collecting the data and making sure that we have evidence-based data and work and programs that we can share with the state and with others about the work that you do with communities. Our community-based organizations who are involved with the work that you are doing, along with your team, Christine and Brittany. Brittany's the only one I could find a picture of online, but I just wanted to say thank you. Thank you so much. We have had a lot of meetings for different projects, and I'm just grateful because it's not my strength. The data pieces are not my strength, and I'm so grateful that you all are doing the work that you do, because really that has been the communication, that has been the connection and the link to legislators, to state officials, to government officials, so everyone that really on the that are not on the community level to understand the work that we're doing. So thank you so much. Next slide. These amazing people you've seen, and Grant, I think you've seen in the chat, when I started doing this work, they invited me to a University of Utah panel to talk about CHW work. And ever since then, they have been supporting the work that we have been doing on an academic level. And this project that AHEC is doing and Dr. Lopez is doing, Karen, who is my boss at the University of Utah, who is doing supporting the work of CHWs in the Pacific Island community, has just been amazing. And I just wanted to say thank you for your support. These people have been those who are saying, did you ask the community what they think? Did you ask the community what they feel is right? Or are you paying the community? They have been true advocates on so many levels at the university that I just wanted to share and say thank you to all of them. Next slide. On a county level, Jennifer has been with the CHW Coalition since the beginning, since I've been there and serving on the work group. So the work that she has participated in is showing here as well. And Darren, who is at the county, is working with us on another project, but anytime we need data, he and Sai are always willing to look at what is available specific to the communities that are requesting that data. He's not afraid to say in their meetings, like, can we do this? Even though we already know the answer is no most of the time. And so I just wanted to thank you both for your advocacy on a county level, and especially for including me on your CHW interview panels as you hired new CHWs for the county in addressing the community needs. So thank you. Next slide. Association of Utah Community Health. I put in the chat there for Cynthia, Ashel, and Alan, especially Star, who's not there anymore, but they have been supporting this effort since the beginning. And if you want an example of how to get your CHWs or how to support them in this work, they have allowed their CHWs to attend the meetings during work hours, to participate in leadership. They volunteered so much time for the CHWs to be engaged in the work that's going on as a part of this initiative. And that to me is like true partnership. I mean, that is true support. Like Cynthia said, a lot of times everyone's looking for that ROI, they're looking for the data. And we struggled with that in the beginning as we were looking at what is being collected by organizations and what is going to really show the impact that CHWs have. And a lot of it was qualitative, but you know, they believe in this program, they have been supportive of this program, and again, they've showed it by allowing their CHWs to really build capacity by being leaders on the workforce development group, in the leadership of the section, and also in providing training to CHWs who are a part of the section as well. Next slide. This lady right here, what can I say? Who does not know Joyce Kim? She comes to us representing Health Choice Utah or Steward Health, but for me, she has just been a community member that has a true heart and love for people. She's always serving, no matter what is going on in her own life or with her job. Those stresses don't even you know, stop her from doing the work that she does. And the reason why I wanted to say thank you to her, because the connections that most of us, if it was done through me, it started from her, because I don't know anybody in Utah. And when I came here, her, along with Jake Fitisimanu and Susie, our leadership chair, they were the ones who connected me to community. And from there, I started doing the work that I needed to do to connect with everyone else. And so I just wanted to really recognize, Joyce, thank you for your Connect the Dots event, because a lot of us have met through those events on different levels. And if there's anything that I need, if it's a doctor or a legislator or some even guy from a level I can't even touch or reach, I know that I can call Joyce and she'll connect me, and she always introduces me to a lot of people, and then that's how the work continues. So thank you so much, Joyce. And then our section. These are the leaders that are in our section leadership right now. They will be speaking to you at the end of this conference. But I wanted to just say, again, many of them are CHWs at the Association of Utah Community Health. Susie is an executive director for her own organization that's helping communities. And I just wanted to recognize their, there were times when we were all just like, what are we doing here? Why are we doing this? What is my role? What can I contribute? And these women have stuck through all of that, especially during this COVID pandemic. I don't think they knew what they were getting into when the pandemic started, and they just started in their roles. And but they're doing an amazing job, and I wanted to say thank you to all of them. Next slide. And then my backbone. You all know these women. They have been the foundation, really, of moving this work here in the state. And they have their own lives and jobs just like everyone else, but they continue to come back, keep coming back for more. And it'd be funny because we'd come back to the section meeting and say, I'm so sorry, you guys, I feel so guilty and I don't want to do this, but I have to step back. I have to step back because this is too much. I'm feeling burnout, and I just need to take a break for myself. And then the next day, they're all in the same meeting, participating and advocating for the work that's being done. So you all know who they are. Thank you so much to Jeanette and Yahemi, and also to Ashel, who has been someone that has been growing through this whole initiative of the CHW work. And I'm so grateful to have all of them as a backbone for the work that I do. Next slide. And then to all of you, thank you so much to all the community health workers, to all the leaders, to all of our partners for all the work that you are doing in your fields and in all of it. Please do not ever think that what you are doing is not making a dent in the work that we do, because every family, every woman, every child, every conversation that you have to advocate or provide or connect resources to our community members, and not just our community members, but our partners, those who don't know about the work that we do, or even if it's your boss or your supervisor, your work does have an impact. You are contributing more than a dent to this work, and we need you so much, if not now more than ever, because what lies ahead of us is, we don't even know. But what I do know is that they will continue to need the work all of you are doing in this field. And so I wanted to just these are not even all the people that I needed to say thank you to, but I didn't have time, and they are who I thought of, but all of you, just thank you so much for all the work that you do. Please continue to take care of yourselves and be safe, and now have a good lunch. So I won't hold you back anymore from your lunch. Please come back. Our community panelists will be ready for you. And then we have some awesome closing presentations that we want you to be a part of as well. Thank you so much. And we'll see you in a little.